Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower arch and the possibility of a liner treatment that can be initiated. As we can clearly see in this 3D reconstruction, that a bone plating has been done. The bone plating has been done for fracture lines here and fracture lines here in the symphysis region of the mandible. On the panoramic view, you can clearly see that we've got the fracture has started to repair and started to heal. This is the transaxial view. On the transaxial view, we're going to show you the lower arch. This is the lower right canine. The lower right canine, as you can see, is in close approximation um, to the plate. And as we are moving towards the lower right lateral incisor, the lateral incisor has the plate attached to it on the buccal or the facial surface. So we can see that there's a little bit of external resorption here, but otherwise, the root movement will be a problem, but mesial or distal tipping of this tooth or proclination of this tooth should not be a problem. But retroclination or root movement is going to be slightly difficult. But since the aligners don't do bodily movement, so hence that should not be a problem. As we're moving to the central incisor here, we can see that this central incisor on the lower right hand side has no problems, and this can show very good aligner movement. The central incisor in the lower right hand quadrant, as you can see, again has no hindrance and can has good bone support and can undergo aligner treatment. The lateral incisor on the lower right hand quadrant again has good bone support, as we can clearly see that there is no absolute problem along with the plating. As we're moving to the canine region, on the canine region here we can see again the plate is quite inferiorly and is not going to hinder with the movement of the canine. Yes, the canine has the plate very close to it, so again root movement is going to be a problem, bodily movement is going to be a problem, torquing is going to be a problem, but tipping, proclination or tipping in the mesial or distal aspect should not be a problem for the patient. But yes, retroclination might cause a hindrance in the canine, but otherwise should not be a problem at all. This is the tooth from the incisal aspect. As we're moving down, you can clearly see that in the mid-root level of the lateral incisor and the canine here, the plate is visible. Otherwise, after the APCs, the plate has major role to play, as you can see here in the bottom, and this is where the screws are. So if there are any further questions, please feel free to reach to our team. Thank you very much.